Hello everyone, I'm Fola. Welcome to the 10th episode of the Diversifying Research Podcast. This is a podcast where we amplify the voices of underrepresented individuals who are either involved in research themselves or engage other underrepresented groups in research. Over the course of this limited podcast series, we'll critically consider how to improve the inclusion of underrepresented voices in research. During this episode, we're joined by Maria Piggin, who works in the Patient Experience Research Centre at Imperial College London. I'm going to speak to Maria about the differences between public involvement, engagement and participation, but from the perspective of the public, the benefits of public involvement and the ways members of the public can go about getting involved in research. Hello Maria, how are you?
Hi Fola, thanks for having me.
It's fine. In case people didn't listen to the previous podcast we recorded together about public involvement, but mainly in relation to researchers, could you please introduce yourself to our listeners?
Sure. So my name's Maria Piggin. I'm the Partnerships and Training Manager at the Imperial Patient Experience Research Centre. So we primarily provide advice, support and training to researchers who sit within the Imperial Biomedical Research Centre funding stream.
Awesome. So I invited you onto the podcast because you're a public involvement practitioner and you have amazing insights. To start off with, could you explain how public involvement differs from public engagement and participation for members of the public?
Sure. So each of those three words is really a different sort of amount of involvement really between the public and research. So public participation is when somebody takes part in a research study. So they might give blood, they might answer a questionnaire, they might give answers in an interview setting, and that person is somebody who the research is about. So they're being researched, if you like. So public engagement is the concept of just talking about research. So you might go along to a science cafe and hear a researcher speak about their research and ask them some questions about what they're doing and hear about the research. So that's engagement. But involvement is really where patient or a member of the public is part of the research team. So they really get to have an opinion about the way the research is designed, whether the research question is appropriate for the part of the population the research is about. Perhaps it's a patient group, or maybe it's members of the public. It could be about something like flu, for example, so something that affects everybody. Or it could be asking patient group about their priorities for their specific medical condition. So involvement is really a two-way street, we describe it as. So the public really give the researchers insights that changes something about their research or hopefully makes it better.
Thank you so much for those explanations. In terms of public involvement activities, could you explain what those actually entail?
So activities are really different ways of having a conversation. So it really depends on the research project and what stage it's at as to what type of conversation or activity might be appropriate. So, for example, researchers are required before they are able to obtain funding from a funder to show that they have talked to some members of the public. Talk to them about their research and ask them whether they think it's what we call acceptable to them, and explain what they're doing and ask for any sort of initial input. And that's even before the project is funded. So because the researcher, they don't have funding because it hasn't been funded yet, but they're required to have these conversations with members of the public to get the funding. They're in a sort of a chicken and an egg situation. So in that situation, we would suggest to them that they identified a few people that they could have an initial conversation with, that they could bounce their ideas off. But then when they write their research proposal and their application, they include a lot more detailed activities that involve the public, which might be having a member of the public sitting on the management committee or steering group for the project, so that that person brings the public or the patient perspective to the progress of the research project throughout its lifespan. And you could also involve the public in sort of workshops to review. It might be documentation that you're going to be using in your study. But for example, it's quite hard to sort of review documents sort of sitting in a group or with a number of people around. So you might ask people sort of individually in a quiet moment, just review. It might be your, what we call a participant information sheet, which people who take part in research need to read and sign so that they've understood what it is they're taking part in and what the risks might be, and include sort of some other legal requirements that you need to put into those kind of consent forms. So making sure that those are really understandable is important. So you might email that to somebody and ask them to give you comments. So that could be just sort of an email exchange. But when you sort of want people to bounce ideas off one another, or perhaps they're going to have a sort of a more richer conversation when they've got other people around them who have similar experience, you might get them together for a discussion or a focus group, sometimes we call them. So it really depends on what the research is about and what stage it's at and what it is that the researcher wants the public to talk to them about or give them insight about.
Those activities seem to really empower the public, which is really great to see. And of course, everyone's aware that we're in the middle of a pandemic. Have there been any public involvement opportunities which members of the public have taken part in or are able to take part in at the moment that is around COVID-19 research?
Yeah, so initially after the pandemic started, things were sort of a bit manic for everybody in terms of our clinicians and our researchers were obviously, a lot of them were very involved on the front line. So they had to reconfigure services in hospitals, and a lot of them had to be redeployed to treat patients that were ill with COVID. So there was a bit of time where we couldn't really do a lot of public involvement because things were just quite busy, sort of just dealing with the pandemic situation. But as time went along, we managed to be able to involve people in the research that was going on into COVID-19. So some of the ways we did that, we obviously had to move things online, which provides a challenge for people who don't have internet or devices to access the internet. But it's sort of been an iterative learning process, trying to understand what works for people, what time of the day that people are available to talk to us. I think it helped a lot that a lot of people were stuck at home during lockdown, so they were quite available sort of at random times of the day. So we used Zoom because we understood that that's an easier virtual platform to use than some of the other ones from the public perspective if you've not used that kind of thing before. And it's got breakout rooms, so we would have an explanatory conversation at the beginning, and then we would put people in smaller breakout rooms so they could essentially have smaller discussions about topics. And some of the research that my team's been doing is things like antibody testing. So people pricking their fingers at home and dropping some blood into a little testing kit, and it's to show whether somebody's got antibodies or not to the COVID-19 infection. And although those tests can't really be relied on an individual basis, meaning we didn't want people to change their behaviour depending on the result of that test. They were useful on a population level, so they were helpful for us to know across the population that had been tested how many positives, how many negatives, how many invalid tests, because then a statistical analysis could be done to understand about how many would be correct. Now, that messaging was quite hard to deliver to the public, and our public involvement helped us try and do that. So we asked members of the public, how can we convey this quite complicated message to people where we're saying, do the test and you get a result and tell us what your result is, but by the way, you can't rely on the result. So it's things like communication and making sure they're sort of understandable and your answer to people's questions are really important for research. There's still obviously COVID-19 research going on. That antibody testing study is continuing. There's other things going on where we tried to gauge people's behaviours during lockdown, and since lockdown has started easing. So we did a big survey about how people were affected by lockdown and whether they could comply with the government guidance and how hard that was for them depending on their personal circumstances, and how people found things like shielding, which has been obviously really difficult for a section of the population, and how people are finding things since the guidance has changed. So there is still research going on, and we are still inviting members of the public to get involved. And we've got a lot of people who've signed up to hear about research, really more than we've ever had before be so interested in research. And I guess that's because COVID-19 affects everybody in some way.
It's good to hear that members of the public are interested in getting involved. If someone's listening to this podcast and they would like to do a bit of public involvement, how can they get in touch?
The best thing to do would be drop us an email at publicinvolvement@imperial.ac.uk, which is our team's email address, and we can send you a link to sign up. So to keep your details to be able to contact you in future, we just have to comply with data security and GDPR requirements. So we just need to make sure that we're letting you know about your rights in terms of that. And we're going to put you in a distribution list so that we can let you know about future things that come up and that you might be interested in getting involved in.
Awesome. Thank you. And earlier on in the podcast, you spoke about the issue of digital exclusion and how hard it is to engage people who don't necessarily have access to devices or to certain apps, or who aren't computer literate, so can't necessarily get involved. Can you elaborate on some of the issues you faced in relation to digital exclusion during this time and how you've tried to tackle it?
Sure. So this is a really important issue and something that is a challenge, and we're really trying hard to find solutions to, especially because COVID-19, has shown how much health inequalities have an impact on how unwell people are with COVID-19 and how this is a real priority area. So we're really keen to try and ensure diversity of voices of people that are informing research, especially those who are particularly affected by it, even more so. So what we've really realised is that if you didn't have relationships with people or a way to contact them before the pandemic, that's obviously really difficult to build those relationships in a pandemic. So if we want to contact people that we previously haven't got a relationship with, we have to rely on, for example, networks that people already have or can connect us to. And community leaders are really important. So they can advise us, for example, on the best way of involving and engaging the community. So near the beginning of the pandemic, we could see that there was a need for more information for people. They had loads of questions. So we tried to do a lot of signposting for people to places, community sort of organisations like Healthwatch had brilliant information on their website, which was being informed by the local councils and the CCGs and things. So we were trying to really link up with all of our contacts to understand what the sort of picture was in our communities that we serve, and so that we could try and address those unmet needs. And I know a lot of work went on in the White City community with providing families with sort of activity packs and dongles which could access Wi-Fi and things like that. But, it's definitely not something that we've solved. I know that perhaps people could use WhatsApp or phones rather than using the internet. But it's true that, things like Zoom and Teams have been the things that we've sort of defaulted to do public involvement. But, we really need to find better and different ways so that we're involving all different people with different accessibility requirements in what we're doing, because the COVID-19 research, impacts everybody. So we need as many different voices as possible informing that.
It's definitely a massive challenge, but it's great to see that you are devising ways to be more inclusive. As you're aware, there are certain underrepresented groups within public involvement, for instance, ethnic minorities, people with disabilities, LGBT individuals, among other groups, and they're often referred to as seldom heard. In your view, do you think it is important to engage those communities and involve them in research? And if you do, why?
So the answer is definitely. And this seldom heard expression really should be turned around to really be often ignored. So it's really the research community's responsibility to go and proactively try and go to people and try and involve people in their research rather than expect people to come to them, because some people wouldn't even really know that public involvement was the thing they could get involved in. I mean, research itself, I think, needs much more sort of awareness around, who it affects and what it is and who can get involved with it, let alone involvement as a concept to be on the research team. So I think there's a lot of awareness raising generally, and definitely with often ignored communities or voices. So, research is about everybody in the population. So if you're only hearing from certain parts of that population, you're not getting a representative voice and perspective, because, people see things very differently and people are affected very differently. And there needs to be input from all different kinds of people into the way research is designed. And, different parts of the community would find different things acceptable, depending on your background, your ethnicity, your gender, your disability. So it's really important that researchers try and be as representative in the people that they involve in their research, as well as the people that take part as subjects in their research. So some recent NIHR guidance for application forms asks researchers that question, whether how representative they've been in trying to include people in their research. So it's definitely a topic that is of very high importance. It was something that, in terms of the public involvement, people were trying to involve often ignored people, but even more so in COVID, where it's become so important to do so when you see how disproportionately affected parts of the community are by this disease.
Definitely. And I imagine there are certain listeners who are part of underrepresented groups who would like to get involved in research. Can you tell us if there are certain requirements for members of the public to get involved in research?
So there aren't any. You don't have to have any experience of a condition specifically. You don't have to have any training in research. You don't even need to have any background in science or have done science at school or anything. Somebody can have just lived experience by having met people or having experienced going to the doctor themselves. I mean, it's unheard of these days that someone has not got a family member or a friend who's had a condition or been affected by a medical issue, and therefore that person, without probably even realizing, has an opinion or an insight or a perspective that they could offer that could really add value to something that research is concerning. I mean, we all could be affected by flu every year, and that is a topic that researchers are constantly looking into, and now we all could be affected by COVID-19. So there's really wide-reaching topics that could potentially affect everyone, that everyone could have an opinion about, and you don't need to understand the way research works. It is helpful to have an understanding of the process, but when you get involved in public involvement, or if you express an interest, we do offer you training so that you can understand, just generally how the process works, so that it means that you can have more background into the big picture of research to get involved in it. But really, you don't need any experience at all.
Okay, it's good to hear that anyone can get involved in research. Since you're very active within the public involvement space, what are some of the benefits, monetary and otherwise, to members of the public who are involved in research?
So I mentioned the National Institute for Health Research, which is one of the major public funders of research. So that's taxpayer money, essentially, that funds those funding streams. And they recommend that patients in the public's time from being involved in research should be remunerated. So we follow their guidelines in terms of payment. It works out about £25 an hour, depending on the level of involvement. And when we're in a time when there isn't a pandemic and people can travel or need to travel to do an activity, we always reimburse their travel expenses. So that's in terms of payment for involvement for people's time. But there are lots of other benefits. We're told by members of the public all the time that they experience from being involved. It might be sort of meeting researchers that they go on to do more work with in projects that they're really interested in. It might be building up their knowledge and their confidence. It might be something that they go on to put on their CV that helps them some way in the future in terms of their own personal development. They can meet other people. A lot of people who've sort of had some involvement with healthcare or health treatment, really like to find a way to sort of essentially give something back. So a lot of people feel like getting involved in research helps them do that. But, people get involved for all different kinds of reasons. And I think that they find it really rewarding and interesting.
Those are great benefits. I hope that people listening who are not yet involved in research will be encouraged to find out more about public involvement after hearing your responses to the different questions. So within your role, you run amazing public involvement sessions which members of the public might be interested in. Could you speak about what those courses involve and how people can sign up?
Sure. So myself and a colleague from the Imperial Clinical Trials Unit co-deliver with a member of the public a rolling series of 5 training sessions on public involvement. So they're aimed at both researchers and members of the public. And the sessions are 2.5 hours long. They used to be face-to-face, but we've moved them online onto Zoom. And we've broken up all of the information about public involvement. Well, not all of it because there's so much, but the 5 sessions deal with different things. So the first one's just a general introduction. The second session covers roles and responsibilities and facilitation of sort of groups of people in terms of maybe it's a discussion group, because sometimes researchers won't have had any sort of training about, what happens if one person talks a lot and another person doesn't talk at all, or someone's phone keeps ringing. So we do a mock focus group to sort of give people an idea of what it's like to be in a focus group or to run one. The third session covers the first 3 stages of the research cycle. So the research cycle is broken into 7 different stages, and we cover the first 3 stages and the ways the public and patients can get involved at those stages. The 4th session covers reviewing participant information, documentation like a participant information sheet and consent form that I mentioned earlier, and also how the public can improve recruitment to research studies. And the last session covers the last 4 stages of the research cycle and how members of the public and patients can help inform those 4 stages.
Those seem like great sessions. And how can people sign up or find out more about these sessions?
Sure. So those training sessions are advertised on our website, on the training page that you'll find there. The Patient Experience Research Centre website is www.imperial.ac.uk/Patient Experience Research Centre. So have a look there. You'll find our public involvement resource hub with lots of examples and case studies and template documents that might be useful for public involvement. We've got a blog which has some examples of what researchers have previously done in terms of public involvement in the past and how it has helped their research. And you'll also find our training sessions there, which you can sign up to.
Awesome. Thank you. We're coming towards the end of the episode. Is there anything you want to speak on that we haven't yet covered?
So I guess what I would finish by saying is that please do get involved and contact us. Really, the more people who bring a different perspective to research, really, the better it can be for everyone.
Awesome. Thank you again, Maria. It was great to just learn about the different opportunities for members of the public to get involved in research and why it is so important. I'm sure our listeners have also learned a lot. If you are listening to this podcast and are interested in public involvement, do get in touch with the Patient Experience Research Centre and share the episode with your friends who might also be interested in public involvement. Thank you for listening to the episodes in this series. It is very likely that this is the final episode of the series, and I hope you found our different speakers informative, engaging, and interesting. Thank you.